The Emerging Enterprise Awards are brought to you by OCBC, Asia's best SME bank, and the Business Times.
Chronic diseases are rising across Asia. But what if doctors could predict complications before they happen? That's what MeshBio aims to do. The Singapore health tech company uses platforms like Dara Health Intelligence and Health Vector Diabetes to turn patient data into predictive insights, helping clinicians move from reactive care to truly proactive and personalized treatment. This mission earned MeshBio a spot among the Emerging Enterprise Awards 2025 winners, recognizing their innovation and growing impact across the region. Joining us today is Dr. Andrew Wu, co-founder and CEO of MeshBio, to share their journey, what this award means, and where data-driven healthcare is headed next. Dr. Wu, it's an absolute honor to have you on the program.
Thanks for having me. Good morning.
Yeah, thanks for coming on. MeshBio was born out of a very real challenge in chronic disease care. Can you take us back to some of the early days? What personal or professional experiences made you realize this problem needed solving in the market?
Yeah, thanks for that. What really influenced me in my career was just as I was graduating from university, right? My mom had suffered from hypertension for many years and eventually had a stroke, right, just as I was graduating. And that was challenging for us as a family. She lost a third of her left brain, wasn't able to speak for a couple of years. Thankfully, she's a lot better now, thanks to the amazing healthcare system that we have. But as I mentioned, that really influenced the direction of my career. And I ended up in a lot of clinical diagnostics work. I was developing in vitro diagnostic tests, running clinical laboratories. And all through that time, the mission has always been, how do I, through diagnostics, support doctors, deliver insights into what's happening in the patient's health, and more importantly, as mentioned in the intro, have these insights be useful for patient care and guiding trajectories, right? So I guess it was towards the end of my previous job that as part of the diagnostics world, we saw that artificial intelligence, particularly the field of computational biology, was rapidly maturing. And there was a tremendous opportunity to leverage this data that us as diagnostics professionals were generating and combine them with this new technology to really supercharge the insights that can be generated from the data and, more importantly, bring it to the bedside to support clinicians as they care for patients and in that journey. And that's where I guess I came together with my co-founder, Arsen, who now serves as CTO, to form MeshBio. And we've known each other since university grad school. But he went through the research career with A-STAR, with the Bioinformatics Institute, and was developing AI and software algorithms to model human health and biology. So it's really a convergence of our respective expertise and careers that led to the formation of MeshBio back in end of 2018, early 2019.
Yeah, Dr. Wu, that's quite a comprehensive solution you've created in the healthcare space. And no surprises then that you've been recognized for doing so on a larger stage. Which award did you win at the Emerging Enterprise Awards? And what does winning it mean for your team?
Yeah, thanks. It was a complete surprise. So big thanks to OCBC, Business Times, and the judging panel for the recognition. MeshBio was selected as a finalist for the Emerging Enterprise Award, of which we are one of 3 winners. I guess, as mentioned, we really didn't expect to win. There were so many exceptional companies that were part of the finalist lineup. The recognition is about the work that we're doing, not just building a business, but a business whose mission is focused on impacting patient care, supporting clinicians, providers, especially as we see that Singapore has an aging population. The rise of chronic diseases, as you mentioned in the introduction, really places a huge burden on our healthcare system. So this is where we see technologies like artificial intelligence play an emerging role, right? And hopefully we're going to be a critical part of how healthcare systems better allocate resources, focus the care and attention to patients that have the highest risk and need it the most, right? And ultimately, what we hope to do is bend the curve in the incidence rates of chronic kidney disease, which is, of course, a huge burden in Singapore.
Yeah, you certainly bent the curve in the judges' minds. I want to talk about the
Love that.
I want to talk about the award process, which was pretty rigorous, the selection process, that is. Site visit assessments, judges' pitches. What stood out to you from that journey, and how did those stages shape the way that you have come to reflect on your business?
Yeah, entire journey of the competition and the judging process was new to us, right? Normally you put in an application and there's an opaque judging process in the background. But in this case, we had an amazing opportunity to meet with people from OCBC, even the assessors who are audit firms, talk through our business model. They asked about our expansion plans. And of course, when it came to judging day, it was a really diverse panel. I think that was covered in the news article. But I think questions around how we're thinking about growth, right? Not just growth in terms of revenue or sales, but how do we think about growth in terms of impact, right? Especially in a company like ours, right? We've been really privileged to serve patients and providers in Singapore. Now we're expanding across Southeast Asia plus Hong Kong. Next step for us is really thinking about global expansion, as we have demonstrated we can bring this technology to bedside, working with our healthcare systems in Singapore. But then how then do we think about countries like in North America, Europe, and elsewhere? So that entire journey through the competition was not just having us think more rigorously and be more disciplined and answering questions about how we're building the business, but also our aspirations to bring it global.
Yeah, you alluded to the fact that you operate here in Hong Kong, in Indonesia, and the Philippines as well. What have these different markets taught you about scaling health tech solutions in diverse healthcare systems? What are some of the challenges you've faced?
Well, before MeshBio, I had already had some experience commercializing and bringing new technologies to countries around the region.
Yeah.
But I guess being co-founder now, it's really where the rubber hits the road and feel it a lot more viscerally. I guess the practice of healthcare is ultimately the same across the world because it's focused on delivering value to payers, insurers, and the patients themselves, and also improving outcomes. But how that's delivered, the infrastructure that's in place, the heterogeneity in the way providers deliver practices, of course, is going to be so different from country to country. I mean, Singapore, of course, it's a much smaller country. We have 3 major public health systems. Indonesia is 17,000 islands. Providers have their medical institutions spread across tens of cities, right? So being able to account for that heterogeneity and the diversity, because for the same health system might have a very AAA hospital in Jakarta, but nowhere near this level of infrastructure in a lower tier city. So being able to accommodate these differences as we scale and grow regionally has been a great learning journey for us. Challenging, but hugely rewarding, especially as we start to touch patients' lives.
Yeah, I want to speak more about patient outcomes and impact. Digital twin technology to that effect is still a fairly new concept to many. How do you explain its role in helping clinicians assess, for example, long-term kidney disease risk for type 2 diabetes patients?
So the premise of a digital twin, as compared to perhaps what might be more commonly known around AI or black box machine learning type of models, is that we aim to model or measure what's actually happening in the patient's health or biology in a transparent, explainable manner. Explainability being the key, right? Taking a mechanisms-based approach, right? Trying to understand which mechanisms are functional or have gone awry or dysfunctional, right? And by taking this transparent approach, mechanistic approach, we are able to resonate and engage with clinicians and doctors better, right? And this is where we've had the amazing privilege to partner with the leading clinicians from SingHealth and NHG as we developed our health vector digital twin. So in essence, as early as 2020, when we first started collaborating with Tan Tock Seng, then expanded a collaboration to SGH, we've demonstrated our health vector is able to take standard clinical blood tests, right, as part of a routine diabetes patient's clinical follow-up or journey, fit that into a model, and then predict with a really great, exceptional accuracy of over 86% whether they're going to get chronic kidney disease in 3 years or not, right? And we validated this across thousands of patients, published it in a journal, got it approved as a software as a medical device by HSA in Singapore, which is probably one of the first in the world, right, to get regulatory approval for this concept of a digital twin. And we're super excited now. It's been integrated into the 2 public health systems as part of an implementation pilot. And we're seeing that thousands of patients are benefiting from this new tool every day.
Yeah, it's excellent. And I look forward to see what transpires on that front in the future. I want to circle back to the Emerging Enterprise Award again, which is without a doubt a significant feather in the MeshBio cap. How do you see that recognition shaping your company's next chapter in terms of growth, innovation, and leadership? And where do you see the biggest opportunities for MeshBio to deepen its impact, especially as chronic diseases become a much larger burden across the region?
Well, firstly, I hope that this recognition from the Emerging Enterprise Award is a big encouragement to the team. As you know, with startups, sometimes we are so stuck in the trenches, working on day-to-day deployments, dealing with data, dealing with software, ensuring security. So recognition externally is a huge encouragement to the team. And what we hope is that through this platform and even this interview, right, it will be an opportunity to amplify the mission that we are on. We believe that the future of healthcare is going to be predictive, proactive, as compared to, I guess, the older paradigm where healthcare only kicks in when something bad has already happened, reacting to things like chronic kidney disease when it's already happened. But taking a much more proactive approach is where we see the future of healthcare. That's where we see that digital twins can catalyze this future, preventive, personalized medicine. And as mentioned, going regional is a big part of it. The sponsors of the award have regional presence, and working together with them as we continue to scale our impact and scale our solutions across Southeast Asia and Hong Kong.
Yeah, and I'm sure what you've achieved has inspired many young companies to follow in your footsteps. So I want to conclude by asking why you personally would encourage young companies to take part in the Emerging Enterprise Award.
As I described earlier, the judging process was very rigorous. We had to, within a safe environment, answer very astute and probing questions about the nature of our technology. Why does it matter? The unit economics around solutions, because of course, with any enterprise, it has to be scalable and sustainable. So these questions are invaluable as any new emerging young company thinks about building a meaningful, scalable business.
Fantastic stuff. We have been in conversation with Dr. Andrew Wu, co-founder and CEO of Mesh Bio, whose work signals a rather meaningful shift in how healthcare can be delivered smarter, earlier, and with patients truly at the center. Dr. Wu, thank you so much for your time and your insights.
Thank you so much. It's been a pleasure being here.
Keep it right here on Money FM 89.3.
The Emerging Enterprise Awards are brought to you by OCBC, Asia's best SME bank, and the Business Times, recognizing the young, bold ambition of businesses in Asia under 10 years old.